This is a continuation videos for our educational series about your high cholesterol. As we discussed in previous videos, there are three main reasons for high cholesterol: inflammatory foods, chronic infections, and toxin exposure. Well, today we'll talk a little bit about the inflammatory foods. Everybody is saying, well, you have inflammatory food and you should not be eating it. What does it mean? Well, obviously, if you have food that is highly processed sugars, or you drink a lot of pop, then it will cause abnormal inflammation in your body, in your gut, and that will create different bacteria in your gut. And those bacteria typically will release LPS, lipopolysaccharides, that will cause more inflammatory responses in your body and will lead to high cholesterol. But very commonly we consume foods that supposed to be good, like salmon, sweet potatoes, blueberries, but if your body cannot tolerate that food, then it will become also inflammatory food for your body. So it's very important for you as a person, as a patient, to know exactly what is actually irritating your gut, what is irritating your system, instead of just saying, well, don't eat dairy or don't eat bread or gluten. Not everybody will benefit from not eating dairy or not eating whole grains, because those actually have very rich sources of vitamin B6, of vitamin E, and very commonly I actually see patients with very low vitamin E in their systems, and vitamin E is a strong antioxidant that actually protects you from the inflammation. So before jumping and saying, well, I'm not going to eat all these bad foods, figure out what you are intolerant to, and then you can adjust your diet in accordance to those tests and figure out what needs to be eaten and what should be avoided. Follow me for more. In the next videos, we'll talk about chronic infections and chronic toxic exposure.